I'll let you know. Hello and very good evening, all of my people. Welcome to the session on the very important topic today, which is polycystic ovarian disease, PCOD. Very important topic. So I would request everyone to pay attention, stay tuned for the session. I would like to welcome our doctor to enlighten us today on the topic is Dr. Sanjeeva Yasmin from Apollo Cradle and Children's Hospital Chirag Enclave. We welcome you, ma'am. Also, I would like our audience to ask our doctor whatever doubts they have, to listen to her very patiently, and just make sure that you ask your queries and use listen to the topics and things our doctor has to speak about the same. Stay tuned till the last because we'll be taking all your queries and questions by the end of the session. Doctor, you have the stage now. Thank you.
Okay, so polycystic disease or polycystic ovarian syndrome, which is PCOD or PCOS, it's a common disorder that is, very commonly seen among women. And, it can be said that 2 to 26% of the women can suffer from PCOD. Now, basically, we can say that it's not a disease per se, but it's a lifestyle disorder. So it is more commonly, seen in those people who have some family history. It can run in the families, people having history of diabetes in the family, and what is PCOS actually? It is characterized by polycystic ovaries. Now, what is polycystic ovary? So when we do an ultrasound, we see that the ovaries are bulky and polycystic. That is because what happens is that they don't ovulate. Here, normally in a normal menstrual cycle, there would be ovulation, the follicle ruptures, and the egg is released in a particular cycle. But here, because of hormonal imbalance taking place in the body, there is more of male hormones which are being released. These are called the androgen. So the androgen level goes up. So as a result of this, ovulational dysfunction takes place in the body. So, when there is no ovulation, the follicle does not rupture, although many follicles are in the process of developing. So this leads to the, picture of bulky ovaries on the ultrasound. So when we do an ultrasound, we see that the ovaries are bulky. Now, only seeing bulky ovaries on ultrasound does not mean that the person has PCOS. Now, PCOS has certain, symptoms. The symptoms can be irregularity of cycles, like infrequent cycles, or when the cycles cannot, they don't come on time, there would be some delay in the cycle. Then now the delay can be more than 40 days, 45 days, or even more than that. Sometimes cycles can be very infrequent, or there can be no period at all. Now when the period comes, the cycle, the bleeding can be erratic. There can be very scanty bleeding, or there can be heavy bleeding. So irregularity of the cycle, erratic bleeding pattern, these are seen in PCOS. Not only this, there can be other symptoms like weight gain is commonly seen. Now, the normal BMI of a person, BMI is calculated like it's the relation between the body weight and the height of a person. So normally we say that the BMI should be between 19 to 25. So when it crosses 25, we say that it's in the overweight category. And when it is more than 30, then it is obesity. Now, people who are, on the higher side, they have more weight, they are more likely to have polycystic ovarian disease or PCOD. So what happens is that there is weight gain, there would be acne, or excessive hair growth can occur, and because of irregular cycles, it can even lead to difficulty in conceiving. It can lead to infertility. So these are the symptoms which are normally seen with PCOS or PCOD. Now, what happens? What is the cause? As I told you, it's a genetic condition. It often runs in the families, and people having a diabetic history are more likely to have PCOD. But maintaining a healthy lifestyle is very important because weight gain is mostly associated with this problem. And since I told you it's a common disorder, mainly seen in the young women, young population, so maintaining a healthy lifestyle is very important. Eating, balanced, healthy diet, maintaining weight, maintaining the BMI between 19 to 25. And what happens in the body is that there is increase in the hormones, the male hormone level, androgen, especially testosterone level goes up. There is also insulin resistance. That is, the body produces more insulin because the insulin does not work. So, to lower the blood sugar levels, the body needs to produce more insulin. So, as a result of the insulin resistance and the male hormone going up, ovulation does not happen on time. There can be no ovulation or infrequent ovulation. Because of this, the menstrual cycle becomes disordered. Now, if the cycle is very infrequent, less than 3 times in a year it occurs, then we need to take care, because sometimes this can lead to other problems later on in life. Then apart from this, as I told you, it can lead to infertility as well. So taking care of the diet is very important. Going for exercise is very important. Exercise should be at least 20 minutes or 30 minutes of brisk walking every day, or at least it is recommended that 150 minutes of moderate intensity exercise should be done in a week. And our aim is to maintain the BMI between 19 to 25. Okay. Then second thing is this, uh, how do you know that you have PCOS? What is the way how we diagnose? Diagnose is based on basically the clinical symptoms. Like when a patient presents, she comes to the doctor saying that, yes, I've gained weight recently, and after gaining weight, seen that my cycles have become irregular, they're not coming on time. When I bleed, the bleeding is very scanty, and she has started noticing excessive hair growth, or there can be acne or some infertility problems. So basically, these are the different types of symptomatology of PCOS. This is how anybody can present. So, based on the symptoms as well as the findings of increased hormone levels, the androgen level going up, there can be increased LH level as well, which is called the luteinizing hormone level. And of course, finding on ultrasound that the ovaries are polycystic, bulky polycystic ovaries. These things help in the diagnosis of polycystic ovarian syndrome. So once it is diagnosed, our main goal, like we can put the patient on medicines. There are medications available for regularizing the cycle, for reducing the insulin resistance in the body, for the treatment of infertility. But the main purpose or the main goal should be to maintain a healthy lifestyle. That means eating a healthy balanced diet, proper sleep in the night, avoiding smoking, alcohol, and maintaining a good lifestyle. Because there can be many long term health related problems which can occur in a person who has PCOS. Now, the long term health related problems which can occur are, like, one is diabetes, type 2 diabetes. If there is insulin resistance occurring in the body for long, this can lead to type 2 diabetes later on in life. Not only type 2 diabetes, there can be other high blood pressure, cardiovascular problems can happen. There can be even cancer of the endometrial lining, that is cancer of the womb, which we say can happen. This is especially seen in those women who are obese, like they have more weight, and then they don't menstruate. Like if they have infrequent menstrual cycle, like bleed for less than 3 cycles in a year, and then when they bleed also the bleeding is so heavy, so they need to be assessed on time, like to prevent such complications happening in the future. Because endometrial cancer can lead to gross problems. So to prevent these lifestyle disorders, like it can even lead to psychological symptoms, depression. So it is very important that it should be diagnosed on time. Like anybody having PCOS should timely come to the doctor. And basically, as I said, it's not a disease, it's just a lifestyle disorder, which we can say, because it mainly is associated with the kind of diet we have. People having a lot of junk food, properly following exercise schedules and all. So that's how it can basically be prevented. And nowadays we see many youngsters coming in the OPD. So PCOS has become really common in the population. Approximately, I can say, 20 to 25% of young people suffer from this problem. So definitely, many the different people can have different symptoms. Like somebody can just come with menstrual irregularity, that menses don't come on time, and the cycles are delayed or infrequent, irregular, and when the bleeding comes, it is very scanty in amount. So that can be a symptomatology, that only menstrual problem is there. Somebody can have, along with menstrual problem, there can be a lot of acne on the face, or there can be some excessive hair growth as well, occurring excessive hair fall, which can cause balding. then somebody can have infertility issues. So we investigate likewise, and for infertility also we need to treat the PCOS. So that way we treat depending on the symptomatology, like how one is presenting. If somebody is having menstrual irregularity, we have to treat in that way. Somebody having other symptoms like infertility, excessive hair growth on the face, or acne, so treatment is ideally different, but we treat with medications. But the main issue is that it can come and go sometimes. Somebody can just notice that if the weight goes down, then the symptoms start improving, like the cycles can become regular. And a person having irregular cycles, she may notice that she has gained some weight recently, 5 to 7 kgs maybe in 1 to 2 months. And the moment she has gained weight, she has started noticing that her cycles have become quite irregular, erratic, or she has developed hair growth or acne on the face. And she can go on some weight losing schedule. And when the weight goes down again, the symptoms can disappear, her cycles can become regular. So it can come and go, it can come and go. But basic thing is this: we have to maintain a proper lifestyle program, a proper diet, that is taking plenty of fluids, and taking a healthy balanced diet, like more of whole grain cereals, whole grain foods, like whole wheat, plenty of fruits and vegetables and diet. Then lean meat, instead of taking red meat, going for lean meat, fish. So kind of low calorie diet, and at the same time a diet which would give proper nutrition, plus proper fluid intake, avoiding stress, taking proper nap or sleep, avoiding alcohol, smoking. So these are some of the things which are basically associated with lifestyle problems, stress related, so which can all lead to PCOS symptomatology. So that's how we basically manage. And as I told you, I've already told you about the cause of PCOD, because the most important thing is this: there is no exact cause, but we know that it is genetic, runs in the family. People having diabetic gene are more likely to have it. And I've told you about the symptoms of PCOS. But then now comes the diagnosis, which I have already told you that. And then the treatment. Now treatment is always related to the symptoms, and there is no definite cure. There is no definite cure, but yes, we can help with the medications for lowering blood sugar if somebody has developed diabetes or insulin resistance, medications for inducing ovulation if somebody with PCOS comes with infertility. Because in PCOS, infertility happens because the egg, the ovulation does not happen properly. The egg does not form, and there is no rupture of the egg, means there is no ovulation. So no ovulation means there would be no pregnancy. So in that case, we induce ovulation. So ovulation induction drugs are now available. Then in the meantime, if somebody comes with irregularity of cycle, we can put on the hormonal pills, which we give for a 21-day cycle, for regularizing the cycles, that can maintain the menstrual cycle. And of course, it is very important that any person having PCOS, if the cycles are delayed by more than 3 months, then it is very important to induce the cycle. That is, we give 5 days course of progestogen tablets, which are to be taken once the menstrual cycle gets prolonged. Like every 3 months, it is recommended to shed the endometrium by taking the withdrawal bleed with progestogen tablets, which are given for 5 days. So these are the different symptoms of PCOD. And I think if anybody has any question, can ask.